Good afternoon, everyone, and welcome to the 75th of the COVID Calls. This is a daily discussion of the COVID-19 pandemic with a diverse collection of disaster experts. My name is Scott Gabriel Knowles. I'm a historian of disasters at Drexel University in Philadelphia. Today, we have a discussion of COVID-19 in Brazil with Rosanna Dent and Gilberto Hochmann. You can catch COVID Calls live every weekday at 5 p.m. Eastern Time on YouTube Live. Just go to the COVID Calls YouTube channel to watch. You can also hear COVID Calls recorded as podcasts on Spotify, iTunes, Stitcher, Podbean, or anywhere that you get podcasts. You can also keep up with COVID Calls using Twitter. Just go to the handle @USODisaster or @COVID Calls. Please do help spread the word and send suggestions for future guests and topics, and please feel free to suggest yourself. As of today, June 26, 2020, there are 9,695,375 confirmed cases of COVID-19 globally, according to the Johns Hopkins University Coronavirus Resource Center. That's up from 9,506,788 cases yesterday. Of those, 2,453,044 are in the United States, up from 2,407,167 cases. There are now a total of 124,891 deaths reported in the United States. That's up from 122,370 deaths reported yesterday, and those numbers have gone up in a really surprising and very unfortunate way. In Brazil, there have been 54,971 deaths from COVID-19. I'd like to introduce my guests for our conversation today. It's one I've really been looking forward to, and let me introduce them. Rosanna Dent is an assistant professor in the Federated History Department of New Jersey Institute of Technology and Rutgers, Newark. She has published work on the history of epidemiological research in indigenous communities and the history of genetics and anthropology in Brazil. She is currently working on a manuscript that examines the political and social history of research interactions in Xavante territory, as well as a digital humanities project to return scientific materials to the communities they document. My second guest, Gilberto Hochmann, is a researcher and professor at the Casa de Oswaldo Cruz Fiocruz in Rio de Janeiro, Brazil. He's the author of works on health policies in a historical perspective, such as the book The Sanitation of Brazil, Nation, State, and Public Health, 1889 to 1930, which was published in 2016 by Illinois University Press. His current research is about science, politics, and health in Cold War Brazil. Rosanna and Gilberto, thank you so much for joining me today, and welcome to COVID Calls.
Thank you for having us.
Thank you for the invitation.
I'd like to start the way I always have with these conversations, just to find out where people are and what the situation is like there. So, Rosanna, may I start with you, please? Where are you calling in from? What's the pandemic situation there? And if you wouldn't mind saying a bit more also about racial justice protests going on where you are, if there are any.
I'm calling in from Philadelphia, so I'm not so far from you, I think. As you know, things here are kind of starting to open up. I really had this privilege of being able to work from home, so I haven't been out a lot except to attend protests, and just a moment of reflection has been to see just how many people are wearing masks, how many people are taking care of each other in those contexts of protest. But I thought I would also say that if I weren't for COVID-19, I wouldn't be available right now. I wouldn't be here. I would actually, I would be in Xavante territory in Mato Grosso, which is central Brazil. It's a cerrado ecosystem, like a savanna ecosystem, so not a tropical jungle. And I thought maybe I'd give a little bit of a picture of what COVID is looking like in indigenous territories right now. So to complement your data on Brazil, according to the Epidemiological Bulletin of CESAI, which is the subsystem of indigenous health, which is part of the Ministry of Health in Brazil, as of yesterday at 5 p.m., there were 5,093 confirmed cases, 2,487 cured cases, 645 suspected cases, and 129 deaths that have been identified as indigenous people from different ethnic groups in Brazil. Now, the indigenous organization Articulação dos Povos Indígenas do Brasil, APIB, which gives a much higher numbers. I couldn't find the most recent, but last week their figures were sort of like 60% higher for cases and 180% higher for deaths. And so they're reporting a fatality rate for COVID that's sort of like twice the national average in Brazil. And I'll just say very quickly that in the Xavante territory where I would be working if I could have traveled, there are infections spreading, and the situation is really considered quite critical because Xavante live in multi-generational houses, much like many other indigenous groups in Brazil. They have communal water sources, which makes really social isolation and hand washing safely really difficult. But so far, the village where I collaborate, there haven't been any cases, and they're doing a lot of things to try and prevent them, which I'm happy to talk about more.
Just to stay with this for a second, so this is an area you've returned to frequently as a researcher, and undoubtedly you have friends there and social connections there. You're able to keep in some contact during this time?
Yeah, as I think we'll probably talk about, Brazil is very, people in Brazil are very online, are very social media savvy. And so I'm in communication on a regular basis with folks that I collaborate with there in the villages through WhatsApp. And so I actually just got a whole set of photos from some of the folks who work with me on the Digital Humanities Project. They've left the village, they're down by the river, they're social isolating, so they're fishing and hunting a lot more, doing a lot more collecting of food, traditional foods, to try and stay out of the cities, to stay out of the context of buying food, because in the surrounding urban areas that are sort of a number of hours away by truck, there are active cases of COVID, and they're very, very worried about bringing it back to the village. So I can report back that there are many beautiful piranha being eaten today on the banks of the Rio das Mortes.
And you've seen it, okay. Thank you for that orientation. And Gilberto, the same question to you. Where are you calling in from, and what's the COVID-19 situation there right now? I'm
calling from Rio de Janeiro, and situation not only in Rio but in Brazil is very difficult now. I didn't got the most recent numbers this afternoon, but around each day, the last days, more than 1,000 deaths, and we are reaching 55,000 deaths. That's terrible, and there is no light in the end, because we can discuss why we are living this situation in Brazil related to the government, how our government is dealing with the situation. And now it's very hard because COVID-19 is reaching what we named the popular areas, the favelas, and the peripheral areas of Rio de Janeiro, and it is a tragedy. Then the situation is very bad. I'm working at home. I'm teaching graduate students online, but my institution, Fiocruz, is on the front line of the response. Then we have a hospital. We lost colleagues in this fighting against the disease. This is increasing. We have a new hospital of 200 beds for COVID in Fiocruz, Rio de Janeiro. And also Fiocruz, perhaps today is the most important institution or health institution dealing with the epidemics. Then, especially related to Amazon area, that Rosana also knows that Fiocruz is sending people to many indigenous areas that we can talk about this situation. Then the picture of Rosana draw is absolutely real and dramatic. Especially when people are rich, people that are in contact with the indigenous population, especially now in very west of Amazon area, in São Gabriel da Cachoeira, it's very hard. Then I don't know, the perspective is very similar to the US. Perhaps we are talking about the same, with different levels of problems, but it has the same problem, just increasing. The states and municipalities like Rio de Janeiro are opening the economy when the curve is rising. Then the perspective is not good. The only thing I understand, that I just talk with people from Fiocruz, that related to the vaccine, people are preparing, if the vaccine succeed, especially the Oxford vaccine, that's testing now in Brazil, in São Paulo. Brazil becomes the testing field for the vaccine because the spreading of this, that's a problem, but Fiocruz is trying to prepare to produce the vaccine if some success with this vaccine we will reach at least at the end of the year.
I see. Well, thank you for that context, and also sorry for the colleagues that you've lost there at Fiocruz. Very sorry to hear that. I'd like to get some background here for those who may not be as familiar, like myself, with Brazilian history. Rosana, let me start with you, because maybe it seems you have such great knowledge of indigenous populations in Brazil and your own ongoing research. And maybe you can sketch out for us a little bit of the background, how we should be thinking about the epidemiological or epidemic history of indigenous populations in Brazil.
Sure, absolutely. So I guess we were talking just briefly about how I'm in contact with folks in the village where I work, and the prominence of WhatsApp, the prominence of social media. And I guess I'd just start by saying it's not tremendously surprising that there's been one of the rumors, one of the sort of pieces of what I think is almost definitely false information that's been circulating in networks among indigenous groups has been sort of reports of being experimented upon with hydroxychloroquine. So as you maybe have heard, very much like Trump, President Bolsonaro has been trumpeting the use of this of hydroxychloroquine since early in the pandemic with no evidence. It has since been, I think, disproven. And Brazilian scientists were among those publishing some of the early studies that showed the health risks of using hydroxychloroquine to treat. But this comes back to this question of this kind of circulation of false news in these social media sites. Where I think a lot of indigenous folks are very worried that they're being given treatments that are experimental, and that relates to a much longer and deeper distrust in some of the scientific research and medical treatment that comes from longer legacies of scientific work in communities, in indigenous communities throughout Brazil. And I would say that there's a really lovely, and this would be maybe a great episode for you sometime, a group of scholars who got together to write about Zika and to think about sort of different historias, different stories or histories. And in Portuguese, the word is the same, as Luisa Reis Castro points out in her work. There's these different competing stories about what the epidemic of Zika was, but also you can think about that more broadly for epidemics in indigenous populations. And so the work that I've done, and this is sort of co-authored work with a colleague who's actually also at Fiocruz, Ricardo Ventura Santos, has looked at some of the epidemiological research in the 1970s, or 1960s actually, sorry, that was trying to understand the biology of disease and the epidemiology of disease in indigenous communities in the wake of the depopulation of the Americas. So at a moment when Brazil was opening up, colonizing the interior of the country through formal processes, through government-sponsored development projects. During that time, the researchers arrived thinking that this was maybe an opportunity to understand something more fundamental about the biology, the epidemiology of indigenous peoples. This idea that maybe there was a less competent immune system in indigenous groups, which could explain how disease had swept through the Americas at the moment of colonization, in the 15th, 16th, 17th century, these much longer disasters that started with the process of colonialization. Now, for example, Francis Black, who was one of these epidemiologists who was at Yale, what he found as he did his research, and he used the measles vaccine as a model to try and understand the immune response of TDO and other indigenous groups, what he found was actually that there wasn't a big immunological difference. In biology was pretty much the same. The indigenous groups that he was researching had just as competent immune system as any other human groups. And so that's kind of one story, right? This biological account of the depopulation of the Americas being about disease and really being about something biological instead of the social conditions of colonialism. I think if you were to look at stories that come from indigenous communities, and here I'm thinking specifically, some listeners might be interested, for example, Davi Kopenawa co-authored with Bruce Albert an amazing book called The Falling Sky, which has been translated into French, Portuguese, English. And there he really talks about this moment of contamination and infection that comes with the presence of the whites in Yanomami territory. And actually, another person who's been writing about this in terms of COVID and thinking about this in terms of now is a graduate student in anthropology, Francinea Fontes Baniwa. And I would really recommend that people take a look at her piece. It was translated into English, so you can find it on the University of Manchester's Cultures of Anti-Racism in Latin America blog. And it's entitled Memories of the Past, Fear of the Present, Being Indigenous in the Face of the Pandemic. And what she does is she looks at this moment, this profound fear that she's experiencing in this moment as she thinks about, the upper Rio Negro is where her family lives, she's Baniwa, and she's, she writes about this saying, quote, "I've already heard so many accounts from my grandmothers, uncles, aunts, and parents about measles, chickenpox, and whooping cough back in the time of the rubber plantations. At night, we ate dinner, and then they'd start to recount things that had happened in the past." And so there's this lived memory that for Baniwa is not even that distant. These epidemics were in the 1960s, 1970s, 1980s, and these are lived histories that people are still experiencing. And so that context, I think, is really important to make sense of what's happening for indigenous communities throughout Brazil now. Many of them have living relatives who were alive during these recent epidemics. And so COVID both is more terrifying and also is in this context of real resilience of people who are surviving and have been surviving for 520 years.
that continuity in the way you draw it out. I mean, you've done it so skillfully and economically, and the way that you said this, it's passed along through stories or folklore and other means. Are there tangible markers of that history in some way, either erected there in those communities or the government itself somehow marking? I mean, aside from what may happen in educational institutions, is there some way to read that history, either in the land or in the memorial or some other way to do it, or it literally is being passed along in this in a much more sort of oral or literary tradition, the way you're describing?
I think that you can read it in the land if you think about the depopulation and the history of depopulation. I mean, if you think about Brazil does have, relative to other countries in the Americas, a large percentage of its land demarcated as indigenous land, but 13% is very little if it used to be 100%, right? And so you could think about the physical scars on the land of agribusiness, of plantation slavery, of sugar production. You can think of these as real markers of indigenous genocide in a certain sense, because none of those things could have happened without the depopulation. And as we know, the spread of disease is really related to social and historical facts, not to biological facts. And so I think there's one way to think about the land itself as being marked by that. But there's also an incredibly rich oral tradition, and each different community, village, people is going to have their own oral tradition. I'm not sure really who among them, and there's definitely written stories, histories that reflect this. I'm not sure how many of them are available in English, but different groups do have things that they've been working on.
Gilberto, let me turn to you and sort of hear from you a little bit about your work, giving some context for us to understand the interplay between science, medicine, and politics in Brazil's history.
Related to the epidemics, my book is about the old Brazilian Republic, the end of the 19th century and the beginning of 20th century. My question was related to why and what the paths to the construction to build a national policy, health policy, how the state until least answer to the problems like diseases, epidemics, especially endemic diseases. My case was especially how to build cooperation between the states and municipalities when you have a federative constitution like the old republic. Then the best example is about Spanish flu, 1918, that got Brazil in the end between September and December of 1918, and the impact of the Spanish influenza, Spanish flu was perhaps the first effort to build a national department of public health. Sociologically, it's a social experience about social interdependence and sanitary interdependence between in the Brazilian society. That's so dramatic that some solutions about a cooperative way between states and municipalities and national state was built in this kind of, it's 1 year after the epidemic of the pandemic of Spanish flu, we built a national Department of Public Health, very small in the sense of the the Sistema Health Unified System today, but perhaps the impact of pandemics, of influenza, was the sensation of no safety, interdependence between okay, it's not the poor people. Brazil was very unequal, is still very unequal. That's a problem. But the idea of interdependence, that you can catch the disease from the poor, was a lead solution to a more national policy, more coordinated policy. Unfortunately, I think today is not it's not the question. We have since the Constitution of 1988, we have a unified health system, universal coverage, and it's very important with a lot of problems, but it's a value that the idea of the health has a right, as a social right, is on the Constitution, and a duty of the national state, also in the Constitution. And despite the problems that you have, perhaps today, this health system with a lot of problems is the best that we have to respond to the pandemics, despite the government and despite the social elites that understand that it's possible to go on with the economy, and left people, special poor people, indigenous people, and Afro-descendants in general, left to a kind of chance, if God or not God, to survive or not. That's a situation. It's a complicated situation. How Brazilian society understand today social relationships, that these pandemics show us so many inequalities, and how to go on with the idea that, like US, you have to the economy is it's most important, or the same like the health of the population. Then, if you make a conversation between 1918 and 2020, I think perhaps it's clear that Brazilian upper class and elites don't worry about the poor and the more fragile classes in our society. Then it's important to say that it's incredible how social movement, like indigenous movement, but in Rio, in São Paulo, are organizing themselves to take care of them. Despite all the problems, you have like people are renting ambulances in poor area to transfer people to the beds that are available in the public hospitals, people checking fever and testing, and trying to articulate some social movement and health movement also of professionals in more peripheral areas of Rio, São Paulo, and others. That it's interesting, perhaps at the end of this, you have. I'm very optimistic, because if not, we will not survive psychically. Survival. But the idea that you have a strong social movement emerging to respond to the COVID, and also the idea, it's incredible, like the from very conservative but not fascist politician that saying how is important our unified health system. Because if not, if you have now 55, the idea with no universal system, I don't know that would be the numbers.
It would be much worse, sure.
Yes.
Sure. Well, I want to remind people you're listening to COVID Calls and my conversation today about Brazil and COVID-19 with Gilberto Hochmann and Rosanna Dent. And Rosanna, I mean, one of the things, of course, we've been talking about in the United States is that it's really quite impossible to talk about the national experience of COVID-19. I'm not sure that was ever really a very valuable conversation, although in the early days we did talk about it, and we talked a lot about the federal government response, but now it's every state, every territory, and every city within states, and every tribal government is also dealing with their own realities of this epidemic, this pandemic. I wonder if you could give us your perspective on how that works in Brazil, particularly in light of what Gilberto was talking about, the achievement of a national health system, which I didn't realize was tied to the 1918 pandemic, although that's not surprising, but it's illuminating to understand that. But maybe you could say a little bit more about health inequalities in Brazil, and particularly what the indigenous experience of healthcare is in Brazil.
Sure. And I would say, I mean, if people want to take a look at some of the really inspiring things that Gilberto was talking about, you can follow the hashtag COVID nas favelas. And what you'll see there is these incredible mutual aid programs that are being put together. And there's a longer history of health activism, both in indigenous communities and in the Black movement. And I would also just draw people's attention to Melissa Creary's work. She talks about biocultural citizenship and kind of the justice movement around the Black movement's work to establish a national health policy for the Black population in Brazil, and how, you know, it's an inspiring tale, but it's also a fraught tale, because when you start to get, you know, special differentiated systems that are focused on particular kinds of health challenges, it's very hard to do that without reifying biological notions of race. And Brazil has very different race relations than we think of in the United States. Categorization works differently. People identify differently. There's not as active, although there's a very active conversation about race, but generally, especially in kind of middle class society, there tends to be a lot more discussion about class. Maybe that's more comfortable than to talk about things in terms of race. So in terms of, and so I would just really recommend Melissa Creary's work, and she has work coming out also on the kind of bounded justice that comes with these sort of small fixes for really systemic problems. And I would say that that's a similar system. I mean, so the Constitution that gives health as a right, the 1988 Constitution, there's an article in the Constitution, I think I had it written down here, it's Article 196, that guarantees Indigenous people specifically a differentiated health service, one that takes into account cultural factors, demographic factors, and also geographical factors, because these are huge issues in terms of Indigenous people having access to healthcare. And there's a lot of challenges that go into creating a national system for Indigenous health. I mean, you have to think about there's more than 305 different peoples who live in Brazil. There's more than 274 languages that are spoken. And in many communities, they're monolingual communities. So, or there will be some bilingual folks, and some people speak Portuguese, but a lot of communities are functioning in the community where I work. Most people, more than half the community only speaks Xavante. So that it can also be really take a long time to get to centralized health services. So hospitals are far away. It might be a couple of days to get to a hospital. And then infrastructure within these villages, it can be really lacking. And it will also be dependent on the status of the Indigenous territory, whether it's been recognized and is sort of federally recognized, and or whether it's in the process of recognition, or whether it's an unrecognized territory. And that's going to determine sanitary sanitation, also whether there's a health post or whether there are health personnel who are serving that indigenous territory. Those are related to these kind of bureaucratic processes, which Bolsonaro ran on a platform of abolishing indigenous land. So, you know, these are things that have been put on hold. Hope I'm not going. So, but I guess to get
I'm learning a lot. Please keep going. It's great.
To get back to your question about, so what is the health like in indigenous communities? Well, it's administered by CESAI, which is the Special Secretary of Indigenous Health. It's divided up into a system of districts, and then the districts are resourced independently from SUS, from the universal healthcare system, but they interface with it. But in general, the resources that are available are incredibly limited. And the Minister of Health, although he's now, you know, he's one of the prior ministers of health, because the Bolsonaro regime has been going through ministers of health at quite a clip lately. He was promising to get rid of CESAI, of this specialized indigenous health system, since 2019. So before the pandemic, there were already attacks on this system. And once the pandemic was underway, in April, I think the next Minister of Health, or maybe the one after that, announced that CESAI would no longer attend indigenous people in urban centers. And so this is part of a much longer issue in making visible inequity in health, which is that urban indigenous populations, indigenous people who don't live in demarcated indigenous land, are often lumped into the category of pardo or brown. They're not given special services, even though they still have the same cultural and linguistic needs that they're guaranteed by the Constitution. And so that's another aspect of how the Bolsonaro government has been really weakening the indigenous health system very systematically. And that's having pretty large impacts in terms of responding to the pandemic now.
So we've brought it forward now into the contemporary politics of Bolsonaro, and Trump's name has been invoked. I want to use that as a segue to get to, there's a couple of questions have already come in, and I want to bring one to you, Gilberto. This is from Tiago Saraiva. He's asking if you could speak to the pressures that Fiocruz scientists are suffering from the Bolsonaro government. Is Fiocruz activity being undermined by the current government? So this gets to this broader issue, which I think we talk about in the United States a lot too, about not only the administration downplaying scientific achievement, defunding science, but also literally going after data, disappearing data, and then even going further, which is to bring specific scientists' names into discussion as opponents of the administration. So I think that's, for me, that's important to think about where that may be happening in other parts of the world. So Tiago's question to you, Gilberto, is how is Bolsonaro's attack on science affecting your colleagues there in Fiocruz?
Thanks, Tiago, for the question. And the problems not began with Bolsonaro. Problems began since the impeachment of President Dilma Rousseff. It's very traumatic, and came a more conservative coalition, and now far-right government with a lot of problems. But Bolsonaro now expressed the very conservative and evangelical thinking in Brazilian society, anti-abortion, anti-human women rights, anti-indigenous people, anti-environment, and a lot of attacks on many fronts. In the science is the same. You have a huge problem of science funding, but once again, since the Temer government, it's not now, it's a process that now is more far right, né? And Fiocruz has a foundation of the Ministry of Health. We are linked direct to the Ministry of Health. Have fighting how to deal with this, all this research, opinion, and criticism that we made about the health systems and science. And we are trying to deal with the situation that's very delicate, especially now. Rosana mentioned the chloroquine questions. And our researchers from Fiocruz Amazonia, from Manaus, was one of the first papers, articles published on chloroquine and the non-effect, the dangers, become prosecuted by some justice in some parts of Brazil. Now they have to hire lawyers to defend, because there's the details on experimentation. Then they are accused to not to like perhaps a Tuskegee experimentation. You have the drug, but you make a experimental group. It's very complicated situation, but not by the government, but by the society. That's the horrible situation now in Brazil, that Bolsonaro is the voice of 25–30% of a society that disbelieve in science and opinion, that's connect traditional anti-vaccinism with evangelicals in many ways. Right. And Bolsonaro is very linked to this kind of political basis, to trying to promote things, non-science. It's very strange for social sciences like me to defend science today. Yeah. After all 2 decades of social studies of science and things like that. Now in Brazil, that's
You're describing the condition.
Yes, I know. And but in case of Fiocruz, we're trying to deal with the situation that for the government, the main institution is Fiocruz to deliver vaccines, health research, the labs on virus labs, and things like that. Then, at this point, Thiago, is a question, you have a lot of pressures. It's very, a situation is delicate, but we did not experiment like censorship or things like that. But the question is, Brazilian 1988 Constitution was health and democracy are very linked. It's very different from 1918. Right. It was a really oligarchical society. 1988, it's health and democracy. For the first time in Brazil, this link between democracy and health, it's important. Now, the question of democracy, the erosion of democracy, it's have impact on health issues. Then it's very delicate situation how to deal with constitutional rights to health and the erosion of democracy. And then
it's
I think we will see perhaps depending on the municipal elections of the November, and U.S. elections are very important to Brazil.
Sure.
perhaps
it's
you
so
have
funny that you.
because you have perhaps when new alliances will be possible in this new situation.
Maybe so. It's interesting that you're not the first person that I've talked to in these discussions who said, the career is dedicated to history of science or STS, and so our job is to be respectful but critical of the claims of science and scientific institutions. And now we find any epidemiologist we can find, we throw our arms around them, and we, because it is really a pitched battle in certain ways. And it's interesting. One other thing I would note, just some recent polling in the United States about Trump, is just to the point you were making, Gilberto, about conservative religious affinity for Trump, which one wouldn't necessarily think would be true to begin with, but laying that aside, it does seem to be softening a little bit, so that there is something here, even for people who may oppose what we would sort of generally say science. They're also not in favor of members of their family dying of a preventable disease. And so we have these sort of values which are coming into very strong conflict here, even in evangelical communities in the United States. This seems to be one of the more recent data points coming out of the polling. There's a question here, Rosanna, for you from Melissa, who's also listening, Melissa Creary, who I think you name-checked earlier. And the question is about, are there any Zika-related responses specific to vulnerable populations, indigenous and otherwise, that were shown to be effective and could be adapted for COVID-19?
That's a great question. I mean, Brazil has an incredible history of successful responses to epidemics. I mean, in teaching the history of global public health, Brazil is and of course I love to give Brazil as an example, this is my area of expertise, but in any course, you're gonna find people who are really addressing HIV/AIDS, for example, by looking at the Brazilian response to give antiretrovirals broadly to anyone with a diagnosis, which ended up stemming a pandemic, an epidemic of HIV that could have been much, much worse by following these right to health discourses, right? And I think that Zika presents some interesting parallels with COVID-19. And here I'm really drawing on this lovely set of essays in Somatosphere, which I would encourage everyone to go and check out. And some of the things there that I think are really helpful for thinking about COVID are the following: that there are certain narratives about who's vulnerable. And I can't give all the authors' names because it's a whole set that go together and I can't remember who said what, but please check it out in Somatosphere. And there's a discourse of vulnerability around Zika, for example, that focused on women and women getting pregnant and women who had the potential to get pregnant or who were pregnant protecting themselves from mosquitoes, with almost no attention to the question of sexual transmission of Zika, which is also sexually transmitted. So women could be very carefully protecting themselves while their partners were not, because the public health messaging had focused in so acutely on who was at risk. And I think you see a similar thing maybe earlier in the pandemic for COVID, but this focus on the elderly, or not even the elderly, but those who are over 65 being at higher risk, those kinds of discourses circulating so easily and quickly at the beginning kind of set up a certain dynamic where younger people were just not as afraid. And you see this replicated by Bolsonaro, who literally talks about how, he's so healthy, he'll be fine, and that normal people will be fine. It's just old people who need to be careful. So those kinds of ideas about who's at risk and how those stories get told are important. Now, in terms of strategies that could be successful, I mean, I think Gosh, I can't think of an exact one from Zika, but I would say in general, there's such a history of really effective public health responses in Brazil, but they were very much predicated on a strong Sistema Único de Saúde, a strong unified health system, and also incredible support for research, which has really been spectacular in Brazil for many years. And these things have been so undermined by the current administration and by, as Gilberto so aptly pointed out, Temer and all of what's happened politically since Dilma Rousseff was impeached. So I do think there are great models that could be used for COVID around the world, and unfortunately, Brazil is in not a strong place to implement them at the moment.
Thank you for that. I want to remind people you're listening to COVID Calls. We're talking to Rosana Dent and Gilberto Hochmann. I want to come to another area here that we've been talking a lot about on COVID Calls, and we have to talk about in the context of Brazil, and that's climate change and environmental politics more generally. So question maybe first to you, Rosana, and then to you, Gilberto. How are the politics of climate change and the politics of COVID-19 interacting in Brazil? In what ways might it be useful to think about both of those problems in the same frame when we talk about Brazilian politics?
Well, oh, go ahead, Gilberto.
I think it's the same frame. The negation of climate change and the negationism of the COVID-19. It's the same frame. And I don't know.
What do you mean by when you say negation, Gilberto? What do you say a little more about that?
It's about, like Trump, Bolsonaro said, it's a little flu. That's the idea. Like you said, to the question to Rosana, and Rosana mentioned, it's like, okay, some vulnerable people will die, but okay, and go on. And the idea that that's not a big deal till now, till yesterday, he said that, with 55,000 dead. It's horrible. And then the idea is climate change with this government, it's a hoax. Like the negations of climate change, all about all around the world, it's the same frame. The same frame. That's science is not important. Health science or environment science, it's not important. What's important is development, or some kind of development. Development of, in the case now, this government in Amazon area is open the doors for mining, destruction. Our environment minister, or our anti-environment minister, it's a contradiction, said in the famous ministerial meeting that they tape in Brazil, and the justice release the idea, let's use the COVID-19 to deregulate all the environment laws, etc. Then there is a alliance between the negation of COVID-19 and the negation of environment, or the interest of agro industry, the big industry, or wood, things like that. And remember that, Scott, I know that you study disaster. This is, think about the mining disasters of the last 5 years, Mariana, Sobradinho, that with a lot of health problems, people are studying not only the disaster, the deaths, of the mining disaster in Minas Gerais, in southeast of Brazil, but all this environment crash that you have with mosquitoes and new diseases, or not new, but the re-enter of diseases with all this mess with the disasters, the mining disaster. Then Brazil is suffering from 4 or 5 years deregulation of environment laws, and also like 300 people died in disaster of Brumadinho, the mining disaster. And till now, you don't have solution. In last January, I make a trip in Minas Gerais, and you have doing the road advises, okay, this is an area of disaster because a lot of the same time of mining barriers in many places in Minas Gerais. That's crazy. Then I would like to put all this together. It's not, okay, you have a crazy government that say that, okay, COVID is not a big deal. People will die anyway in some part of the history of their lives. But also it's related to the attack to the indigenous people. That's very important to the mining areas, and the regulation of the environment. Then I understand that it's all connected now. Unfortunately, it's connected in the worst way, and very difficult to make some barriers to this. Perhaps our salvation will be the international trade that's it's beginning to say, okay, we will not buy more goods if the country deregulate the environment, things like that. But still, you still have, okay, in the mining area, it's Canadian companies in Brazil, things like that. It's a big problem. It's not only related to the Brazilian government, but a very international interest, the big capital that running this kind of advance on indigenous areas and also in mining areas.
So many important things in what you just said, and one of them that I think we have to really be clear about is that it's too simple to talk about a bad COVID response and talk about Bolsonaro or Trump. I mean, I think that's an important part of a discussion, but if that's where the discussion ends, I think we will have very badly misunderstood the many other things that we could be learning at this time. And I just want to put a pin in one other thing that you said there, and Rosanna, also want to get your reaction to this, is that the sort of nature of these problems as interconnected and ongoing, and that we've seen a pretty strong evolution of the approach against that from corporate interests, which at some point switched from, look, we know there's costs associated with mining, but there's more benefits than costs. And then the conversation moved to, we're not so sure that there's good science about the costs. And now just an attack on the existence itself of the threat. I mean, that to me is a pretty remarkable trajectory here. I guess getting to, again, this quite important term, negationism. I don't know, Rosanna, anything Gilberto said there, or any of these issues sort of resonating for you in the way you think about these problems?
Yeah, I think definitely. I mean, there's also the very sort of obvious basic fact that this expansionism and this the federal government giving a complete green light to people to invade indigenous territories for mining, for extractive practices, it continues in the context of the pandemic. And so this is actually a way that the disease is being introduced to communities that are far from medical attention or might have very limited resources for that kind of thing. So in a very literal way, they're intersecting in terms of patterns of infection. But I would say more broadly, Brazil was last so prominently in the news not that long ago for fires, for the Amazon being on fire, right? Which is a product of these policies that really have taken a major turn, because Brazil was a world leader not that long ago in terms of really taking state-led action around climate change and particularly around deforestation. So very, very quickly, the neoliberal or the kind of economic interests have been promoted to such an extent over the well-being of people. And this is really the pattern, I think, that brings together these two things: the environmental disaster that's going on and the health disaster that's going on, is that economic interests to this administration, but more generally, for the past administration as well, these economic interests are just more important than any issues of equity, health access, those kinds of things. And so you see an incredible sacrifice. Now, sacrifice is not the right word, but an incredible violence that's being perpetrated. And I would say, it's a useful thing to think with some of the scholars, and I'm thinking about indigenous scholars, both in North America, like Zoe Todd and Heather Davis have written about this together and thinking about the timing of the Anthropocene. But also, this is something that folks in Afrofuturism and indigenous futurism have talked about. For some people, the post-apocalyptic period is already here, right? And there's a sense that there may also be really important knowledges that are held by communities who have been at the brunt of an ongoing apocalypse that's about plantation slavery, that's about the depopulation of Africa, that's about settler colonialism in the Americas. And so there are knowledges there, and I would highlight work, although it's not translated into English yet, by Alton Krenak, who has a wonderful essay called Ideas para Adiar o Fim do Mundo, which means like ideas to delay the end of the world. And one of the things that he argues, and it resonates really nicely with recent work by Ryan Jobson in American Anthropologist, that there has to be an abandonment of this particular individual liberal universal subject. And that there has to be we need a radical humanism to really understand and value the knowledge practices that people who are living in a post-apocalyptic world already have, because those are the things that can help us. And Krenak raises this question in conversation when someone says, like, what are the indigenous people going to do? He says, what I want to know, we've been surviving for hundreds of years. What I want to know is, what are the whites going to do? And so I think that there's that is a place where these different kinds of slow disasters that have been going on for so many years really come together.
That's very powerfully put, and it also shows the impoverishment of our ideas when we think about this pandemic, that the timeline that most people are working with, and people are worried about their health today, and I don't want to demean that concern and their health tomorrow. But this has to be a much deeper conversation going into, as you're saying here, we're using the term Anthropocene, the period of time in which the Earth is shaped by human action. And you're also bringing into the same frame settler colonialism and indigenous genocide. There is an interconnection there that you have to be willing to move into. Otherwise, you're telling a very, very, very small part of the story and continually surprised by what's coming next, when that surprise is also a tool of politics, I think. We're almost up on time here. I want to get maybe just a quick note from each of you, not necessarily saying, give me some good news, but maybe what is one thing in what's happening in Brazil right now that's giving you some hope or confidence? And I think, Rosanna, what you were just talking about maybe moves us a little bit in that direction. So Rosanna, let me ask you first, something that you can leave us with that gives us some hope for Brazil.
Well, I think, I mean, the many Brazilian people that I love are so resilient in so many different ways and have lived through a lot of disasters in the past. And I would say something that's making me particularly hopeful about this current moment is, you know, in the 1970s and 80s, there were real social movements that grew out of the military dictatorship of that period. I would say there's a strain of anthropology that emerged at that time, which is anthropologia militante, militant anthropology, which took, people really took activism and action as an essential part of the work of the scholar. And I think that, you know, there's some great models there. And what I would say that's happening now that is even more hopeful is that a lot of Indigenous students are in the university, and they're leading some of these conversations, and they're leading some of this kind of action. And so to see people like Josie Juzia Kangang, you know, running seminars online as part of the Free Land Camp, which is a yearly protest. And here, this goes back to your very first question, which is like, what kinds of racial justice protests have been happening? So recently, there was a Free Land Camp protest. This is something that's been happening every year for 16 years in Brazil. It's usually an intertribal protest held in Brasilia. It's a huge camp. They work together to set guidelines, or not guidelines, but agendas, political agendas for the Indigenous movement. It's a very powerful thing. And this year they held it online because of COVID. And so you see, you know, folks like Josie facilitating conversations with an Indigenous diputada, an Indigenous congresswoman who was the first Indigenous congresswoman to be elected, with international participation, with folks from across Brazil talking about, you know, how to have a really robust response in this climate of ongoing political crisis, right? And to see that kind of leadership emerging, I think, is incredibly hopeful. So I would leave you with that.
That's wonderful. Thank you. Gilberto, the final word to you, giving us a note of confidence or hope to take away from Brazil today.
I will return to 1988 in the sense of our citizenship constitution, the idea of rights that we have in our constitution has a north to the defense of basically of democracy in Brazil. That's the main question for me. I totally agree with you that COVID is a global tragedy, but is in a more amplified problem that we are living, and about environment destruction. People are talking not more about Anthropocene, but Necrocene, that we are living in the new phase that to let die is a way of running society. It's crazy. It's like colonial or new colonial ideas. But I'm optimistic in the sense that especially the Brazilian health system to be resilient, it's very important. You have a huge national immunization program that cover more than 10 vaccines for free. There's no other system that like this, perhaps NHS in UK, but for free. That's incredible in the sense of the public basket that offer immunization for the society, then it's like a biomedical biocitizenship. But this link, as you know, the population to the state, not government, but the Brazilian state. Then this relation that are built, Rosana remind us about HIV/AIDS program. That is still running, and Fiocruz is one of the production of the antiretrovirus for the system, and a lot of public programs that link this health system and the population. And now in COVID-19 is the same. Where to run? The middle class in Rio run to the private hospital that at the beginning of the pandemic were full of people. And now the wave of the middle class, the first wave for the middle class decline, and it's beginning more a wave in the popular areas. Then it's the public system that are engaging, open the doors for this. Then, despite all the problems, despite the obstacles that you have the third Minister of Health during a pandemic. Now it's a general of the army that was the general in the Amazon area. It's very specific. Then, despite all this, I think I'm optimist in the sense that the links between the population and the health system will be stronger at the end. There's a reevaluation of the idea of the public that we lost in the last 5 years or more liberal, new liberal economic environment and education policies. Then we will survive, and I hope we will win in the sense of civilization, democracy, and the most important thing for me, empathy. Empathy. This connection that this government don't have any connection with the population.
Yeah.
And
that's beautifully said. Rosana, did you want to make
as well? To say
it's
that
such a stirring. Yeah.
Sorry.
Go ahead.
About emotion.
No, it's wonderful. Thank you.
So beautifully captured also at the beginning. And I wanted to just remind people of this hope of the mutual aid. And that's this empathy that he's talking about, that people are putting in place in favelas, in, under-resourced, majorly under-resourced areas. There's so much care work going on. And that also extends politically. And I don't think we've talked about it. I just wanted to make sure that it's out there, that there have been Black Lives Matter protests also in Brazil. And it's about police brutality. It's about the killing of Black and brown, but especially Black Brazilians, especially by the police in Sao Paulo, in Rio, in the big cities, all over the country.
Well remembered.
And that that's really, those movements are about solidarity here, and they're about solidarity there. And there's a transnational story about this, a shared experience that I think really speaks to the kinds of hopeful things that empathy, this moment that empathy and care is so needed.
So Tiago followed up with a quick note here to both of you that thank you for this illuminating connections, particularly between environment and epidemics. And just to what you were just saying, Rosana, Melissa Query followed up and said, I hope there's a part 2 to this important conversation. And I think that's, so you have now been summoned back by our listeners to continue this, because this point you're making about Black Lives Matter not being only United States concern, but a global concern. And of course, we've been talking, even the framing of this conversation today, talking about COVID-19 in Brazil, and reading those statistics that I read at the beginning. I think it's of course important to talk about in the Brazilian context, but at every turn, we've also been talking about it as a hemispheric context, or in the context of fascism, or in the context of science. These broader frames are absolutely crucial to understanding, and also, I think, to finding solidarity and mutual aid. That mutual aid can be from the United States to Brazil as well. It doesn't have to be sort of locked up within individual nations or cities. So I've learned a ton today. Thank you both so much. I want to remind people you've been listening to COVID Calls, which you can catch every weekday, Monday through Friday at 5 p.m. Eastern Time. I want to also let you know that on Monday, we'll be talking to Paul Offit, Dr. Paul Offit at Children's Hospital of Philadelphia. We'll be talking about, you may know Paul's work, we'll be talking about vaccines and the search for a COVID-19 vaccine in the United States. And Gilberto and Rosanna, thanks a million for this time today.
Thank you so much for having us. It was really been a pleasure.
Thank you so much. It's a pleasure to meet all you.
Stay healthy, everyone. Talk to you soon.